Hello, everyone. Welcome to our session entitled Preparing for Medical School Interviews. For our first speaker today, we have Dr. Neha Vapiwala, who is a recognized and well versed leader, mentor, and advocate. She is a professor and the vice chair of education in the Department of Radiation Oncology at UPenn. Moreover, she serves as the chair of the ACGME's Residency Review Committee for Radiation Oncology and was recently elected to the board of directors of the American Society of Radiation Oncology. Let us welcome Dr. Vapiwala.
Thank you so much, Ronnie and Alexia, and to all the organizers for the opportunity to chat with everyone today. Thank you all for being here. I'm going to go ahead and share my screen so we have an opportunity. And let's see, I have a lot of screens going on, so hopefully this will be visible to you. I'm going to go ahead and bring up the talk, which I did have here. I apologize, I'm not sure. There we go. Hopefully you all can see that. And let me know if you can't. I'll look for Ronnie to let me know.
We see it, Dr. Vapiwala.
Wonderful, okay. So again, we're here today to talk about medical school interviews, right? And I think we all know that with interviews, we're always trying to present our best self. So how do you go about preparing mentally, physically, and in every other way to really do the best you possibly can in the interview setting? And again, this is going to be different for different individuals under different circumstances, but I think there are some basic principles and some unifying themes and then just some core knowledge that should hopefully be of use and great help to all of you as you embark on your medical school application journey. So I want to start with, actually, if you guys wouldn't mind humoring me with just a concept here. What word first comes to your mind when you hear medical school interviews? And I'd love for folks to go ahead and submit one word if you would participate in this poll, and we'll get hopefully a word cloud formed in the process.
So for everybody, we ask that you go to www.menti.com and use the code 31474572.
I'm definitely seeing a lot about nerves in the chat. Nervous, nerve-wracking, standout, conversation. It's a good one. So even though those may not show up on the word cloud, we can see that theme in the chat. All right, thank you for sharing this. And as we see this evolve, I think one of the themes that dominate is the idea of stress and nervousness, anxiety, terrifying, that's a good one. But then, that's also balanced with the idea that it can be eye-opening, that it can be an opportunity for conversation, that it can be an opportunity to get to know the program and the school as much as they get to know you. But I would say overall, I'm sensing definitely a lot of themes and a lot of words that would invoke something that's not pleasant. I think that's fair to say. Questioning your character, thank you for sharing that. So, you have this excitement, but then obviously there's this huge amount of pressure. And I think a lot of these terms that you shared, a lot of these thoughts that you shared really do come down to a high pressure environment. So let's talk about why that is. And, what is it about medical school interviews that is so important? Why all the fuss? So not all professions require interviews. So many of you may have friends in law school, business school, or other graduate schools that are not necessarily required to interview. But for medicine, we fully recognize that both cognitive and non-cognitive qualities and skills matter. And you have only to think of your own experiences, perhaps as a patient, perhaps as a loved one accompanying a family member or a friend to a doctor's appointment, And you think about what actually mattered. Of course, the knowledge and the skill set, and obviously, hopefully, help for the condition that you were going to the doctor for in the first place. But were they listening? Did they seem to care? Did they help make you feel comfortable so you could ask all your questions? So this is important, and it's why the interview process is so critical. And in fact, the American Association of Medical Colleges actually conducted a survey of medical school leadership and asked, what criteria do you use to make decisions about who's ultimately accepted? And interview was the #1 factor, more than GPA and MCAT score. So not only is it obviously a high pressure, high stake environment, but it's often the last step in being able to make that personal connection with the admissions committee, with the school, so you can hopefully make a lasting impression. So let's talk first a little bit about the timing, just the logistical nitty-gritty. You want to submit your medical school secondary applications when you receive the invitation to do so, ideally within 2 weeks. I know that's not always possible, but you want to get those secondary applications out the door. And then those interview invitations are often on a rolling basis as the secondary applications come in, hence the motivation to be timely. And those interview invitation emails for most schools could be sent as early as August and then continue, as I say, on a rolling basis through the rest of the season until sometimes as late as April. Acceptance rates among interviewed applicants vary by school, but obviously getting an interview is a great sign, and it's a necessary, right? It's a requisite step to even be considered for acceptance. So it's not a given that getting the interview is going to get you accepted, and every school will vary on this, but as I say, it's a great sign. So let's talk about preparation, right? You want to first just know the landscape of the schools that you've applied to, that you get invited to interview at. You want to research their format and style of interview that they prefer. What are their tendencies in terms of how the interview day and the interview process goes? What is their acceptance rate among interviewed applicants, et cetera? And a great resource or sources for this information can be certainly current students. If you have friends or family members or connections who are currently at the school, they're definitely a great resource. But so is the school website, because things can change over time. And then online forums, and I definitely advise you to put an asterisk there and a grain of salt, because as with all forums, sometimes the information isn't always vetted, isn't always accurate, and you just want to be mindful of that. Just so you know, there's generally 3 different interview formats though, and there can be school-specific variations, but we're basically looking at traditional interviews, group interviews, or multiple mini interviews. Those are the 3 basic types. And then some schools might do a hybrid of some of these. But again, knowing what you're going into is absolutely helpful. So let's talk a little bit about traditional interviews. These are typically one-on-one, as you might imagine, 30, 45 minutes, depending on the school and the duration of the interview day, but typically 30 to 45 minutes. And it can be with a faculty member, a member of the community who's part of the admissions committee, a current medical student, a practicing clinician who isn't necessarily on the faculty, but is invested in the medical school. And it's usually 2 to 3 interviews. Now, each interviewer might be asked to focus on a particular thing, or they may have a structured format with standardized questions that they are assigned to touch upon, or it might be rather free-form and informal and totally dependent on the interviewer's style, and therefore, subject a little bit to their mood of how rushed they might be or how relaxed they might be that day. Now, interviewers will have, just like you, variable experience with interviewing. This might be your first med school interview, or it might be the last of 15, and you feel a little more experienced. Just remember that interviewers have their own variable experience and their own interview style. So it's possible that the connection will be there between you and the interviewer because you have certain shared interests and the school assigns you that interviewer, knowing that you are particularly engaged, for example, in a particular community service project, and this interviewer also is involved in similar community service. But there may or may not be any such connection. So that's part of the conversation, and part of the interview is getting to know each other. And bear in mind, whether or not it's open or closed file, you may not know. So in other words, the interviewers may have minimal access to your application, just sort of your name, your major, where you went to school. or they might have access to quite a bit more. So you just want to consider that what you're sharing is new information for the interviewer. Don't assume that they know things about you. Don't, assume that they're aware what you did during your gap year. Try to fill in, the information. You don't want to, certainly regurgitate everything in your application, but you want to make sure that the information is complete and don't assume that they know everything in between. Now, group interviews, they're similar to traditional, but often 2 or more candidates are present in the room. So it's this simultaneous interview idea. And that can be daunting for some. It could be comforting because you're not alone for others. But at the end of the day, what it's really about is how you engage with the group. And there might be a teamwork exercise, for example, to try and assess how do you communicate and function and analyze scenarios and collaborate with others whom you don't know. And it might be tempting, to solve, let's say you're given a little teamwork exercise and you kind of just want to do it on your own and you know how you want to go about it. But really the goal of the group interview is to see how do you listen to others? How do you help delegate responsibilities? How do you think about what's best for the group and works for the group's strengths, not just your own? And it's certainly fine to step up as a team leader, but it's also important to allow others space to talk and make sure that you're a thoughtful team leader. So that can be challenging, right? Knowing when to set yourself apart, but also hold back so that others' viewpoints are also shared. And then the third type, the multiple mini interview. 6 to 10 interview stations is pretty typical. And each station is sort of focused on a different question or a different scenario. And you're asked to review the question or scenario, have some time to prepare, and then discuss or react or interact with a patient, a standardized patient, a family member for 5 to 8 minutes. And the interviewer, again, as I said, who may be a standardized patient, is observing and evaluating those responses. This is typically closed file because it's really not focused on your application thus far. It's really trying to look at who you are, how you deal with a variety of scenarios. What are your verbal and nonverbal communication skills? How do you think critically about issues? What are your ethical decision-making skills? Do you demonstrate empathy? What's your knowledge of the healthcare system in general? And the idea here is that you get more opportunities to demonstrate your strengths, and more interviewers, more data points means hopefully more reliable assessment of who you are. And it's less prone to the bias of a particular interviewer. Now, you're not expected to have any specialized knowledge to participate. It's really just, assessing where you are. And as I mentioned, some schools may do a hybrid of traditional and a multiple mini interview. So this is where practice is so important, right? You want to know what type of interview that school is offering, and then you want to try to do mock interviews with friends, classmates, professors, mentors, really anyone who you trust to do it, and try to simulate the real thing to the best of your knowledge. So resources I'll give you at the end that might help you there. But this is where having an interviewer who's at least familiar with the process would be ideal. And then you want to try to have 2 or 3 mock interviews before your first real interview so that you've kind of gotten accustomed, in particular, to talking about yourself. That's not something that most of us are very comfortable with. In fact, most of us probably shy away from sounding like we're just listing all of our accomplishments and bragging. But at the end of the day, you need to be able to communicate important things about yourself and do it in a comfortable way. So you need to know what are your own personality traits that may help or not help you communicate that. And what are your accomplishments and experiences that you want to actually really emphasize? What are some of your tendencies? Do you tend to use, filler words a lot? Do you tend to get nervous and have other certain behaviors that you want to try to get at least some control over? So what are some common medical school interview questions and themes? So for the traditional interview, or honestly for a group interview, it can involve the basics of why you want to be a doctor and what motivates you. Why our school? What's special about our school that made you apply? What are your specific goals in medicine and your future career that you envision? How do you react to times of stress or hardship? And what are your resources that you use for making important decisions? How do you go about doing that? How would others describe you? What do you do in your spare time? Tell about a time or give an example where you tried your hand at something and it didn't go well. And what do you think is the most pressing issue in medicine today? So these are all common themes. These are examples of some mini multiple interview questions and scenarios. So sort of the, camping trip and all you can take is 5 objects and what do you think those should be? So there's some of, that sort of survivor type skills. There's, questions that might have to do with how you advise others in a difficult medical situation, like a close friend telling you their father is diagnosed with colon cancer and wants to take time out from school. How would you counsel your friend? Others can, again, try to get at your understanding of the overall healthcare process. If you have a therapy that is under scrutiny because of the data supporting this therapy is done in only a small number of patients, you're a healthcare policymaker trying to figure out the pros and cons. What is this? What are some of the things you would think about if you're in charge of approving this medication? What if you're in a precarious situation of observing potentially an impaired physician? You enter a hospital staff room with Dr. X, you think you see him taking a swig of a drink that you suspect could be alcohol. You feel like you're observing strange behavior. What do you do next? And then you have, 4 minutes typically, in this example, you have 4 minutes that you're given out of the 8 minutes of this station to pretend you're counseling a patient. So an example is process or purpose of vaccination. And they might have you do this as if you're speaking to an adult patient. And then the second 4 minutes of the 8 minute station might be, now what if you're talking to a child and their parents? So again, this is just trying to understand who you are as a person and how you go about handling these various scenarios. Those are just some examples. Now, I'm just curious if you all had a choice, which you won't, but if you had a choice, which of these interview formats would you prefer? So this is a vote. Traditional group, multiple minis, and then there's all the variations. So if you guys are able to go to the Mentimeter site to vote, otherwise I'll also look in the chat. Interesting. So I know we have, just a small sample size and it's going up as more people vote, but not surprisingly, I think most people perhaps are comfortable with the traditional interview scenario is what they kind of know best. But I see that the hybrids can also be appealing, and perhaps it's a way of kind of increasing the number of interactions that you have and giving you an opportunity to shine in various ways. So thank you guys for sharing your thoughts on this. I think that was nice and interesting. So moving on, and let's see. Doesn't seem to be advancing for some reason. There we go. So I think at the end of the day, and let me just make sure I can, so we have the vote there. Traditional seems to be the most common. And you will find in schools that traditional is the more common format, matching the poll results. But obviously, as I say, just go into the interview knowing what to expect. And knowledge is key. So even though you don't have to have particular skills or particular preparation for, say, many multiple interviews, for example, just knowing about what's going on in the world, current events in particular as they pertain to healthcare. And here's some various reading sources and news sources that you can turn to, and understanding what's going on with bioethics, new research and technologies, policies as they relate to medicine and medical scientific thinking. So even just occasionally just picking up and reading journals like the New England Journal or JAMA, just to kind of know what's out there and what's topical at the moment can give you something to talk about, even though you're not necessarily required or expected to have in-depth knowledge on any of these things. It would just, I think, always be a value in any conversation, interview or not. And then life as a physician, just explaining that you understand what it is that you're entering and that your motivation is not based on just, some fictional idea of what it is to be a physician, but that you've read books and articles by physicians. And Atul Gawande is certainly a very well-known and prominent author in this arena, but there can be other biographies about doctors, historical, nonfiction, time with an actual doctor, but again, reading about it can also be a great way to increase your knowledge base. But in addition to the knowledge base about the world at large, it's really critical that you know yourself. You need to know what is it you want to convey about yourself, what are your personal interests, and anything you can do to enhance who you are as more than just a pre-med student is important to the conversation. And then knowing what you've put in your application. Some of you might not interview until months after you've actually completed your application. Actually, that's pretty typical that it's been months since you submitted it. You better remember and familiarize yourself with what you said, why you said it, what were your 3 most meaningful experiences, why is that the case? Remember, the interview is the final part of your story, but you have to be able to tie it all together. What was the story you told in your application? What are gaps or areas of improvement in your application that you didn't necessarily fully explain or that you want to re-explain during the interview process so that the interviewer knows and doesn't leave without that information? So one of the things that came up in the word cloud quite a bit, right, was nervousness and nerve-wracking and stressful. Totally get it. Just remember, anytime you are feeling so anxious, nervous, jittery, you are so not alone. The vast, vast majority of individuals in this setting, including possibly even your interviewer, possibly your student interviewer, because maybe they're newer to this, might be nervous too. You're not alone. It is so natural. And you've got to turn this into a strength, right? When we're anxious and we're nervous, it actually can raise some of our cortisol levels and give us heightened awareness. And so you just want to maybe turn that into a strength. Use that to be engaged with the person or the people you're talking to, and try and use that focus to think about questions when you're put on the spot. You can also recognize, and people do recognize, that when you're nervous, it's because you care. And if you're overly relaxed and almost sort of, too casual, that can send the wrong message. So it's okay. People expect you to be nervous. You just can't let it paralyze you. And that's where the practice, the mock practices, knowing what you're walking into can absolutely help the nerves. But then don't expect that everything's going to follow a script, right? Expect curveballs. That's part of the process. But always try to bring it back to the story you want to tell about yourself, which has to be overall a positive story. Even when you're talking about things that do go well or areas you wish you could change, you have to try and frame it in the positive. What are you going to do with that knowledge, with that information? How are you working on getting better at XYZ? So a key thing is to clear your head before you go into this, right? Before the interview, gather the thoughts that you have. Work with your body, not against it. There's no point in trying to completely calm the nerves with any, products. Because at the end of the day, again, you don't want to take anything you're not used to, and it's not likely to be helpful. If anything, maybe just some quick light exercise right before to help raise the endorphins and channel your energy could help. And then just be thoughtful about what are you eating and drinking, and have you slept enough? And are you heavily caffeinated? And is that going to hit you at the wrong time in the middle of the interview? And of course, drink lots of water and be hydrated, but also make sure you use the restrooms. There's a lot of things you can do to sort of calm yourself during that pre-interview period. And then during the interview, you definitely want to be calm and focused, right? So you want to find seating and an environment. Now, obviously, if it's an in-person interview, you don't always have a choice of either the environment or the seating. But if there is a way to adjust your chair or to kind of make sure that you don't have to fidget too much or shuffle around or be distracted, to the extent that you can control that, certainly in a virtual interview, much more likely, try to do that. Just be as comfy as you can. Don't forget to breathe evenly, breathe calmly, That always helps center you, whether you believe in meditation or not. It is absolutely invaluable to that interview process. And certainly if you get a curveball thrown at you, just don't forget. Maintain your attention on the questions and the interviewer, because of the fact that you might be obsessing about what you just said, either in the interview before or the question that was just asked you, and you feel like you didn't do a great job and you wish you would have answered it differently. Meanwhile, the interviewer's moved on and is asking you something else. So don't let the train go off the tracks. If you find that you're getting distracted, worrying about what you just said, refocus, because the interviewer wants to move on. They want to give you more chances to get it right. So don't obsess and perseverate in your mind about what you just said. Oh no, because you might miss critical things that they're asking you now, and then you blow that question as well. Remember, they're on your side. They expect you to be nervous. They want to try to get to know you. They don't want to sit there for 30 minutes and just watch you sort of, be a nervous wreck. They want you to be able to flesh out what the application didn't. So at the end of the day, every school wants you to have a positive experience during your interview, so that you walk away with an overall positive feeling. Now, at the end of the interview, you want to, right before it's concluding, you're likely to get asked if you have any questions. And it's never great to say that you have none. Even if you truly have none, saying you have none generally conveys a lack of interest or attentiveness. Now, obviously, it depends on how the conversation's gone and if you've been asking questions along the way. Of course, you don't have to make up something. But if you really haven't had a chance to ask questions, just try to have a list that you can ask. Nothing too specific that would put them on the spot or that they can't answer, but something general, right? Like, what are some of your favorite things about this school, or how did you choose, or why did you choose to work here? Can you tell me more about a certain program? Do you have any advice for me? What do you find challenging and rewarding about being a doctor? And then if there was some issue you guys talked about and you wanted to get the interviewer's take, and if you feel it's appropriate, you can ask them about something that they asked you about. So for those that are going to have virtual interviews, and again, all the schools are deciding this and are going to have different approaches, because we are in this strange period of the pandemic where it's still ongoing, and many schools will prefer virtual, but some are doing in person again. Regardless, it's not a problem. You can absolutely, in this case, optimize your interview space much better than in a real interview. You want to make sure you have your device set up right. You want to make sure it's not in front of something that would lead to distractions. You want a well-lit, quiet space near a lamp, so you're well-lit, and you can see everything as well. And you want a simple backdrop behind you. No distractions, no fancy digital backgrounds. You want to make sure you have an electrical outlet nearby, everything's plugged in and charging, that your phone's on silent. And once you're actually into your virtual interview and you don't have any tech issues, you want to keep it out of view to avoid any pop-ups that distract you. And just because you're in the virtual interview, you still need to be completely, appropriately dressed, usually business casual. But if it's a student-led event, and it's not an interview per se, but it's a virtual event that's part of the school's program for applicants, you're generally allowed to have some casual dress on the virtual sessions. Now, this is more just for reference to always test your technology beforehand. And then, these are the instructions that we give to our Penn students. And we use what's called the AMP platform for the video interview module. So all of our invited interviewees receive this information and instructions. And the point is, whatever school you are applying to an interview at, if they have a virtual interview, make sure you get the instructions from them well ahead of the interview day. And it should be something like this, where they sort of give you their do's and don'ts. But what I would convey to you is that schools totally get that technology is not perfect, glitches happen. So don't sweat it, and just do the best you can by having at least done everything you can to prepare. Now, there's certainly things not to do, and this is not just about interviews, but it can certainly pertain specifically to interviews. So if you've been invited to an interview and you have a deadline to accept it, or to confirm the date and time, don't miss those deadlines, because that interview slot can easily be passed on to someone else. You don't want to disregard instructions, like the instructions I just shared, if it's a virtual interview, or if it's an in-person and you're supposed to show up at a certain location. You definitely want to read and reread the instructions, make sure you understand them. And if you don't, ask the questions days in advance. You don't want to overinflate and misrepresent yourself during the interview. That is a hole that you can dig very quickly, and it's very hard to get out of, particularly if your application is also overinflated and misrepresented. So obviously this advice starts with the application, but certainly during the interview, you don't want to overinflate or misrepresent anything. You want to avoid asking questions that are already clearly obvious on the website or to anyone who knows anything about that school. So even though you want to have some good questions to ask your interviewers or to the students, you don't want to make it so basic that they're wondering if you even know anything about the school. Never, and this, I would hope I would never have to tell anyone on this call, on this conference, to never disrespect anyone, but certainly not staff members who you may think are not directly involved in the process. That's certainly no excuse to ever disrespect anyone. And you don't want to seem like you're trying too hard to curry favor, throwing names around, or sort of using any connections you may or may not have during the interview process. Because most interviewers, that's not really what they want to hear. They want to ask you certain questions, and unless they're specifically asking you to explain a connection to a certain person or to a certain organization, you don't need to belabor it. You also don't want to be essentially telling the interviewer over and over how wonderful they are and paying them all these compliments, because that also is very tiresome, and most interviewers are going to see through that, and it's not generally a positive for you to go out of your way. So there's a way to be polite and certainly be complimentary and respectful, but you don't want to go overboard. Now, at any point during the application process, but certainly before or after interviews, where somebody may decide to just look up something about you on social media, just be so mindful. Absolutely, these days, your internet presence matters. Even if you're not a student there, you want to be thoughtful about any public pictures, posts, tweets, and just exercise your due diligence, because at the end of the day, that's out there in the ether, and anyone can look at that and make an impression about you. So just be thoughtful about that. And at the end of the day, what you don't want to do is forget to have fun and to learn. You're going to learn so much about yourself. You're going to learn about the schools, about the medical profession, your future colleagues who you're going to meet through this whole process. It is an amazing journey. And there are a couple of resources here. I'm sure many of you have your own resources that you may have found along the way as just an example. But I'm happy to take questions from the audience. But I wish you all the best of luck. You've got this. I want to say thank you again to the organizers and to all of you for listening, and certainly stay in touch. I hope to hear from many of you along the way. So I think what I'll do is go ahead and stop the screen share so I can see everyone, if that's okay, Ronnie, and we'll do the Q&A.
Yes, Dr. Vapiwala, thank you so much for that amazing presentation. I'm sure everybody is so now more confident actually with doing an interview. Now we have 9 minutes left for questions, so I'll go ahead and start with the upvoted questions. So one would be, would it be rude or inappropriate to ask your interviewer if they've seen our application file?
I think it depends on the context. So you could just work it into conversation, right? So say you're asked a particular question that involves telling a story. Tell about a time when, right? So you might work it into and say, oh, okay, I'm not sure if you're aware or how much of my application you've seen, but I'm very involved in my undergraduate sorority, and I was president of that sorority, and there was one time where this incident happened. And so you can kind of work it in. Now, the interviewer may give nothing away and decide they're not going to tell you what they have and haven't seen, or others may say, yeah, I'm aware, or I've seen that, or I've had the basics. So I would not flat out ask. I think that could be a little off-putting. What I would do is try to say, almost like a way of saying, oh, please let me know if I'm giving too much detail that you already have. But to set the stage of the story, before I went to school, worked in this nonprofit, so you're starting to tell your life story, and then they may say, oh yeah, you don't need to go through all that again. So work it in, but don't directly ask.
Thank you, Dr. Vapwal. And then our next question is, in a group interview setting, is it good to take charge as the leader, or is there a better approach?
So I think it's certainly great to show your leadership skills, but sometimes taking charge as a leader is making sure everyone was heard and not being the only one talking. So your role as a leader, if you notice that there's someone sort of more talkative and more outgoing who decides, okay, so the team, we're going to do this, this, and this, you could say, yep, that sounds good. Before we do, have we heard from everyone? Has everyone had a chance to share their thoughts? And that is showing leadership, even though you're not the person saying, okay, let's do X, Y, Z. So there's ways to demonstrate your leadership in that group setting, and you don't want to be trying to shout out or shout over someone else, because that's in the end just going to look like you're competing each other. So one of the most important things I think in demonstrating that group interview is that there's different types of leaders and there's different forms of leadership. And if you can find a way, so another example could be, you guys are already working on something, and then partway through you can say, hey, I know we as a team decided on this, but what if there's another situation we haven't thought about? Should we also prepare? So even just, it could be towards the end of the group interview, but making that contribution and coming up with a solution for it is also a way of showing leadership.
Awesome. Thank you so much. And then the next question would be, how do you answer the quote, tell me about yourself question? What should we avoid when answering this question?
Oh, well, I don't think there's anything you need to avoid. I think if there are aspects where you're talking about, okay, I don't ever like to go to class and I, get all my notes later. I mean, look, at the end of the day, you have your learning styles that got you through college, but you probably don't need to share, certain details that could make it seem like you wouldn't show up to required things at the med school. There's just certain stories you might share that could make you or portray you, make you seem like you're somebody who's not motivated or who's not a go-getter or who's lazy or who's judging someone else. So if you're telling a story and you're putting down someone else in the story, those are the kind of things I would stay away from. And if there's something you want to explain about your life story so you can frame it into a positive, then do that. But otherwise, don't bring up things that you're not able to turn into a positive. Those are the things I would stay away from.
I think this, Dr. Vapwal, is a great segue to this next question. What does a successful interview look like?
I think a successful interview doesn't feel like an interview. It feels more like, and one of the word cloud words was conversation. In an ideal world, these are conversations, whether they're mini stations and you're conversing about, wow, if I had to go camping, I could only take 5 things, I thought about this a lot. And depending on who you're talking to, you may get some feedback or some of their own thoughts along the way. In a group interview, certainly you're having conversations as a group, as you're figuring out the exercise or the assignment that you've been given. And then the one-on-one, which is the much more common and comfortable setting, obviously interviewers are not there to just talk the whole time, but to the extent that you can engage them in conversation or let them have moments where they can interject and you're not just asked one question and talking for 30 minutes, that's not a successful interview. So you want to try to have some back and forth. Even if it's question, answer, there still needs to be that back and forth. And you want to create a scenario where you've given enough information that if they want to follow up and ask for more details, they can. And you don't have to give them a 10-minute answer where they've already forgotten what they asked. And you gave them so many details that they're kind of overwhelmed and they don't get through everything they wanted to get through. So you want to leave the interviewer with that room and that breathing space.
Thank you, Dr. Vapwala. And then the next one would be how to answer this question. Why have you chosen our university from the rest of the others? This question is always so difficult for me to answer because usually most of the colleges offer the same program. How to distinguish between them while answering the interview?
Well, I would say every school does have some unique aspects. So even if the curriculum, I mean, there are different curricula out there. There's different durations of preclinical and clinical time. There's different ways in which the medical rotations are structured and who teaches the rotations and what kind of sites. The city, town, state that the medical school is in is going to influence the experience and perhaps some of the patient population that you see. The programs may seem similar, but there's got to be some nuances. So it is your job in researching these schools to find out, what you find to be unique about it. Now, I'm not saying you're not going to have similar answers for certain schools, but every school couldn't possibly have the same answer because every school is not the same. And I think, understanding and learning enough about the patients that medical students get to see and interact with, the research opportunities. What is this medical school a part of? Is it part of a larger university? Is it part of a larger health system? Is it in the middle of nowhere? Is it in the middle of the city? And what does that involve for the students who go there? And what sets it apart? Those are the things you want to learn about and highlight how much you do or don't. Obviously, if you don't like those features, you're not going to want to talk about it, but find something that is particularly positive and exciting for you about that school.
Awesome. And I think we just have one more question that we could answer. In your experience, is it preferred that interviewees answer fairly quickly or avoid excessive silence and compute and answer as they go, or to allow silence to wait for a complete and thoughtful response?
Okay, so I think I heard two questions. One, if you're asked a question, you don't have to feel the need to answer right away. If you need a few seconds to think of a scenario because you're asked to come up with an example when you experienced X. I've had many times where people have said, oh, that's a great question. Just if I could have a minute to think of the example that I want to share, that's fine. And then you take your time and yeah, there's a silence there, but you've prepped the interviewer and they know that you're doing your best to come up with that example. But this is where, again, if you've done the preparation, you can anticipate most of the questions you're going to get. You should have some of these examples in mind, and maybe you're just taking 5 seconds to decide which of the examples you're going to share, but you definitely don't want to be trying to come up with an example for the first time ever and sitting there for minutes in silence. And then with respect to the duration of the answers, when your answers are too short and the interviewer is having to work very hard to keep things moving because you're just giving few word answers and not elaborating, that is generally frowned upon. And it's taxing on the interviewer, and most interviewers don't like it. But you don't have to go from that to the 10 minutes per question, right? There's a normal in between where you share something for several minutes and then you gauge the look on the person's face who you're talking to and the look of the people around you and try to sum up, as you sort of read the room.
All right. Thank you so much, Dr. Vapurwala, for answering those questions that we had. There is a lot more, though, but unfortunately, we are pressed for time, and we have our next session, Perfecting the Personal Statement. So, for those who would like to watch or rewatch this session, it's available on YouTube, and you could find that in the chat. Thank you, Dr. Vapurwala, and everybody have a great rest of the conference.
Thanks so much, everyone. Best of luck to you. Bye-bye.